Isal Perera. I'm a student at the University of Manitoba. Today we're going to be demonstrating complex wound care. So we have all the supplies here and we checked the physician's order, and we have a wound care due for today with our patient. So we're just going to enter the rooms to do a quick safety check, see if there's no tripping hazards, call out nearby, bed is in low vision, patient not stressed, enter and wash our hands and introduce ourselves. So hi, my name is Isal Perera. I'm a student nurse at the University of Manitoba. Can I just check your armbands here for the patient? So wash your hands before you touch the patient, checking the armband. You see the FIN number 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay, and can I get you to state your name and date of birth? Okay, and do you have any allergies? Patient has no allergies. So we're just going to explain the procedure. So Mr. Smith, today what we're going to be doing is complex wound dressing on your abdominal wound. Do you need any pain medication before we start the procedure? The patient does not need any pain medication as they're not in any pain. So now we're just going to make sure the bed is in the proper height, so it's at our waist level, and make sure the table is also at our proper height at our waist level, so to maintain sterility. And also we're just going to close the blinds to maintain patient privacy. So we've done that now, and we're just going to start the procedure now. So we're just going to open up our sterile tray here. Okay. Just open up the corners. So okay, just gonna place this right here because we won't need it. We won't be needing that. Just gonna place the garbage as well. Just right here. Ask the patient if we could place the garbage right here, and the patient said yes. It's fine. So we're just going to add our supplies in now. So we have our gauze, 4x4, simple down and peel technique, opening it up. See, we seems that we have contaminated that one, so we're just going to get a new one. Okay, so we have a new gauze here again, and we're just going to open up the simple down and peel technique again. Okay. Okay, and we're just going to throw that out. And do the same with this as well. Okay. And opening up our catheter here, our caton. And we'll just have our sterile acrylics here. Okay. Open up our 30 cc syringe, adding it in to irrigate the wound. And then we're going to add in some Q-tips as well. We're going to add one more as well. Okay. And we're just going to add in our sterile water right here. Okay, so just gonna have a ruler here, add that in, and then a few Q-tips as well, just by the patient's bedside. So we're just going to now wash our hands. We've got our supplies here. We're just going to now assess the wound. So we washed our hands, now we're putting on clean gloves. Okay. Okay, so Mr. Smith, right now we're just going to assess your wound. Okay, so I'm just going to take off your old dressing. Okay, So we're taking the old dressing off now. Okay. Okay, so we took the old dressing off, and we see that there's, I'm just taking this 4x4 as well, off there, and we're assessing the wound, and we see that there is two, so with the, there's about moderate amounts of serous angular drainage on the two 4x4s and also the abdominal pad, and then we're grabbing our pad, we're grabbing this, and we're going to take the packing off, and we see there's also moderate amounts of serous angular drainage on that. I'm just going to dispose of this, and then we're going to assess the wound here. So we're just going to take our measurements here. So we have about so it's about 13 centimeters in length and about 3 centimeters in width, and then we're just going to assess the peri wound. So we're seeing there's no redness in the peri wound, no swelling. It looks right intact, and then the wound bed, it looks like there's granulation tissue present, no signs of eschar or slough, and no foul-smelling odors or drainage. So we assess the wound. Now we're just going to dispose of our gloves and wash our hands, and we're going to measure our tunneling and also we're going to measure our tunneling and everything out there afterwards. Okay. So now we're just going to we're not going to put on our sterile gloves. Okay. We asked the patient if it's okay if we put the sterile gloves on here by the bedside. The patient said sure. So just gonna take a step. So washing our hands again before we put on the sterile gloves. Okay, putting on our dominant hand first, and putting our left hand on. Okay. Okay, so then we're just going to now fill up our syringe. Just adjusting our stuff here. So just gonna fill up our syringe with 15 cc's of normal saline, but for the purpose of this demo, we're doing it 15 cc's, but in clinical we would use 30 cc's to irrigate the wound. Okay, so we're doing that now. We're just irrigating the wound to clean it 6 centimeters above, from cleanest to dirtiest, inside out, and then or from center out until it runs clear. So it is running clear now. So we're just disposing this in the garbage, and now we're going to clean the wound or dry it. Okay. One dab. Okay, so the wound inside is now dry, so we're just going to clean the peri wound now. Okay, so just going to clean the peri wound. Okay, now we're going to dry the peri wound. How are you doing, Mr. Smith? Doing well? Good. Okay, so we dried the peri wound. Now we're just going to assess the tunneling and undermining and measure the depth. So we're measuring the depth here now. It's about 3 centimeters approximately in depth. We're measuring for any, we're just assessing for any tunneling There's no tunneling present. And then we're assessing for any undermining. No undermining present. We're assessing the wound. You see that there's granulation tissue present, no eschar or slough. The peri wound, there's no redness or any swelling. So we're just going to document those later, okay? So now we're just going to pack the wound. So we're dipping it in the normal saline. Wrinkling out the access. Okay. Can I get a time?
10:35. You have 5 minutes left.
So we're just gonna pack the wound now. Just making sure it's not packed too tightly. Okay, just gonna dispose of this. I'm gonna grab our scissors. Okay. And dispose of this. Dispose of our scissors as well. So our hands are still sterile because we didn't touch the inside of the wound. We're just going to use our forceps just to adjust it. Can I get a time?
12:40.
Okay.
You have 3 minutes, almost 2 minutes.
Okay, so let's pack there. Just gonna dispose of that, and then we have our other forceps here, which are with their still hands still. It's not contaminated. We're gonna put our 4x4s on there, just like as ordered. Okay, and so we're just going to now dispose of this. So the procedure is no longer stale. So we're just going to add our mefix. So we're just going to take our gloves off, wash our hands, and then we're going to add on our mefix.
One minute.
Okay.
Thirty seconds.
Okay, so we've done that. Now we're just going to dispose of everything, and then make sure to call about nearby, do our safety check, patient nearby, and everything. We're just going to do exit check, call, make sure to wash our hands, and we're just going to read the room and document on our IPN and wound flow sheet.